Good evening. Welcome to tonight's webinar, the Z-Wave, your best option for body contouring enhancement and cellulite treatments with Dr. Stephen Weiner and Dr. Gordon Sasaki, sponsored by Zimmer Aesthetic Division. All phones are on mute for the entire presentation. During the presentation, please place your questions in the GoToWebinar control panel. All questions will be answered at the end of the presentations. At this time, I would like to introduce both of our speakers this evening. Dr. Stephen Weiner is a pioneer in the field of minimally invasive cosmetic procedures. After a career that started at Johns Hopkins Hospital, Department of Facial Plastics, Head and Neck Surgery, Dr. Weiner laid down his scalpel in 2005. He now concentrates on burgeoning field of lasers, dermal fillers, and body contouring. Dr. Weiner takes great pride in being at the forefront of new technologies and procedures and is committed to innovating groundbreaking techniques for a natural aesthetic appearance. His time is divided between his clinical practice, physician trainings, lecturing worldwide, and research with industry-leading companies. Dr. Gordon Sasaki is a board-certified plastic surgeon serving Los Angeles, Pasadena, and the surrounding communities. He heads an aesthetic practice and its 3 integrated centers of excellence that focus on aesthetic, age-appropriate needs with evidence-based treatments. The Sasaki Advanced Aesthetic Medical Center consists of the sophisticated, medically based Innovescence Skincare Center, Advanced Nurse Injection and Device Center, and the renowned Surgical Center that are dedicated to patient safety and well-being in a comprehensive and integrated office environment. He is also the clinical professor at Loma Linda University Medical School. I would like to now hand it over to Dr. Weiner.
Hello, this is Dr. Weiner, and I'm going to basically show you how I use the Zimmer Z-Wave in my practice. And Dr. Sasaki is going to get a little more technical than me, but I'll show you how it really improved my revenues with Coolsculpting and how I use it in some new procedures. I'm a board-certified facial plastic surgeon, and I laid down my scalpel, as previously said, in 2005. And all I do is lasers, devices, and injectables at this time. And I'm a speaker and trainer for several companies. I purchased the Zimmer Z-Wave in 2015, and I had both Coolsculpting and Vanquish at the time. The problem was that my body contouring revenues was rapidly declining, and I was searching for a differentiator. The competitors were lowering their prices, and the Coolsculpting was being commoditized. So I searched out and found that the largest Coolsculpting practice, which was in Marina Del Rey in California, was using Z-Wave for all their patients. And so I looked at some papers and examined the Z-Wave and felt that the papers were very compelling, that there was improvement with the fat loss using the Zimmer Z-Wave. And here we go. And so this was the paper that was very convincing. That showed that the Zimmer Z-Wave almost doubled the fat loss compared to just manual massage. And so we all know that Coolsculpting leads to about 25% destruction of the treated fat, and we know that it's a little bit better using the massage afterwards. But after treatment, there are cells that are going to die, and there's cells that are going to live, but then there's some cells that are undecided. And the way I talk to my patients are, the Zimmer Z-Wave pushes some of those undecided fat cells into apoptosis. The procedure with the Zimmer Z-Wave is completely painless, and it can improve the results from 60 to 100%. What it does is it has an energy wave into the treated area, which further injures the cell. So you first have the cold or the heat from the vanquish, and then the energy wave also. So you're just kind of hitting it, kicking it while it's down, more or less. So whenever we get a call from patients inquiring about the Coolsculpting or the vanquish, we would tell them about the Zimmer Z-Wave and the benefits, and how we actually throw that into the service, so to speak. And then the shoppers do realize the value of the Z-Wave, and we actually put a price tag on the Z-Wave of $140, and then we write it off afterwards, and we kind of give them that Z-Wave, and they kind of see that it is a valuable procedure. So immediately after removal, when you have that sort of butter loaf on the skin, we perform the Z-Wave, and it takes approximately 3 to 5 minutes to do. And it can be done by anyone. It can be done by our esthetician, a tech, a PA, or an MA, and it's really foolproof. And we just turn it on its maximum energy and let it go. And there's been 100% reliability of the device over the past 2.5 years. And it's a very small footprint, and it's easy to roll from room to room. So a little bit more about my revenue and Coolsculpting. So I was one of the first to have Coolsculpting in 2009. And my revenues kept rising to about 2012. And then I had a sharp fall off in my revenue as the competitors entered the market and did the price cutting. And I needed a way to differentiate from others. So I purchased the Z-Wave, and my revenue doubled. And I'll show you how that happened. So I bought it in 2009, and it had an increase very rapidly. It was adopted. But then you see there was a gradual tail off in my revenue all the way down to 2015. And in 2015, I actually purchased the Zimmer Z-Wave. And between 2015 and 16, my revenues more than doubled. And now, 2016 to 17, the revenue's even going to more than double again. And my revenues have been so good that I've actually purchased a second Coolsculpting device. I've had Vanquish as well in some of this, but I actually sold the Vanquish because I didn't feel I was getting the results that the Coolsculpting was getting. So I include it with all my procedures. I even use it for Cool Mini. There's a smaller handpiece that's used with the Cool Mini, but the larger one can be used as well. The smaller one is just a little more comfortable. It has 5 minutes to procedures. And I actually increased my pricing. So even though I say it's included, I increased my pricing by $50, and I'm still busier than ever with my Coolsculpting. And this goes to show you how I use the Z-Wave after Coolsculpting. This is a large handpiece done in the abdominal area. And again, it's completely pain-free, and it's really it's foolproof. There's no way to really mess this one up. So in the submental area, when I'm doing the Cool Mini or even doing Kybella, it's very hard to massage the area afterwards. But as I said before, you can use a regular handpiece attached to the Zimmer Z-Wave, or there's a slightly smaller one, and Gordon will get into that. And also, I've noticed that if I use it after Kybella, not immediately afterwards, but the following days, there's a faster recovery and less swelling. So I'm kind of becoming known to do this Sculptra butt lift, and I use the Z-Wave for all my injections of Sculptra into the extremities and into the butt. And I've had no evidence of nodules using the Z-Wave after this procedure. You can also use the Z-Wave, and it's actually FDA approved to treat cellulite with a series of 8 to 10 treatments. And so this goes to show you, I've marked out the areas that I have injected, and then we go over it, and it seems to spread out the sculpture more uniformly. And I think I probably get better results. I've never done it without the Z-Wave. But there's actually some physicians using it on the face after sculpture as well. And then one other thing that I do, you know, we have some VIP patients who come in and say they've wrenched their back or their feet are hurting, plantar fasciitis, or they have neck pain, or they've pulled muscles, a lot of runners we have. And we just offer it. You can either charge them, but we often will offer it free of charge to these patients as sort of a complimentary service to give back to our VIP patients. And they come in once or twice a week maybe to treat these areas, and it just makes them feel a little special, I think. So in summary, the Zimmer has been extremely high return on investment. There's absolutely no risk and no downtimes. It's applicable to multiple different applications. And the big thing that you should notice, it differentiates your Coolsculpting practice. It really separates you from the crowd. It makes you able to charge more, and it makes your practice more popular. So I'll answer questions after the Dr. Sasaki.
Thank you very much, Dr. Weiner.
Sure.
Okay, Dr. Sasaki, I've handed it over to you.
Can everyone hear me if I'm speaking at this level? Dr.
Yes,
Weiner and
Kim,
thank you so much. It's an honor to be here with you. And greetings, everyone. Thank you for joining us to learn a little bit more about this simple but very effective treatment for your patients, and it can really help your practice. I've been fortunate to use the Z-Wave for about 4 years. I use it as a standalone type of treatment and also as a complement to our other non-surgical or minimally invasive or even our surgical procedures. What you see before you are my current disclosures. And I think for me, the Zimmer device is such an important part of our practice because it can differentiate our practice from many other practices because of our ability to augment what we usually do with the types of equipment that we now have in place or in surgery. I'm going to go to the next slide. Let's see, where is that? Okay. What I'm going to talk to you tonight is advanced extracorporeal shock waves. This is a therapy, ESWT. It really stands for the Zimmer. It's emerging technologies that we have in our office as a standalone, but also as a type of procedure that we can bring in to augment our practice. And we just want to tell you where we stand in 2017. We've had it in the office since 2014, and we've been very, very pleased with the device because it differentiates us from others in our busy practices in California. The device, I think you know, has a very usable screen. It's easy to read. There are 2 handpieces. The handpieces are very important because there's a time that you have to relieve one handpiece for the other. And it gives you the options of continuing your treatments without any interruption. In our practice, we almost exclusively use the 39 millimeter head, although we use a 25 millimeter head primarily for the submentum, but the 39 millimeter head services almost all parts of the body. This is a video that shows the way that the head does work. And it's really an electromagnetic field, and it's generated by a coil that's located in the back of the handpiece. And it strikes the applicator head, generating pulses, energized, and it can go down to a maximum depth of about 3.5 millimeters. Sometimes they'll go down, you can actually get it down to about 3.5 centimeters. So you can adjust the hertz, which is the frequency, you can adjust the millijoules, which are the powers, and you can adjust the pulses. The medical applications really began with lithotripsy. It was used for pseudoarthroses, for tendinopathies, for cutaneous calcinoses, for chronic musculoskeletal problems, even for soft tissue wounds that were open wounds, neuropathic diabetic foot ulcers, and for severe burns. But we in the aesthetic arena use it for primarily Cellulite, which is FDA cleared, and there are many, many excellent articles that you can refer to. The body contouring is a great part of our practice with the cryolipolysis and our other methods of body contouring, invasively, minimally invasively, or non-invasively. We did complete an RV study in 2015 with the Zimmer device. The molecular effects are really not that well documented, but if you go to the literature, there's much written about in certain journals that it does affect the CD31 stem cells, the vascular endothelial growth factors that are produced by the stem cells. It does affect the VEGF, endothelial synthetase, and some of the nuclear cell antigens that control the cell proliferation. The biologic effects are the ones that we're more interested in. The usage of this device can improve angiogenesis. It has an anti-fibrosclerotic effect, antibacterial effect, increases skin elasticity, certainly increases lymphatic drainage, increases in using the proper way the collagen matrix, and it does produce cavitation types of effects for destruction of cells that are either programmed to die or they will die. In our experience, we use a Z-Wave in two ways, either a Z-Wave only or Z-Wave with other types of devices we have in our office or with surgery. If we use it only for Z-Waves, we've done a total of about 26 patients, and the average treatment per patient is about 8 in all different types of ethnicities. These are the areas that we treated with Z-Wave only, and you can see that most of the treatments are really to the body area, such as saddlebags, the buttocks, the banana rows, the thighs, the knees, and the abdomen. We are doing it more and more in the facial area, but again, in the facial area, because of concerns about injury to our surgical field, we are very tentative in this area until they get into the postoperative period at about 3 weeks. This is an example, and it's not my patient, but I thought it was a very excellent example of a standalone treatment for body contouring only. We usually work with 16 hertz at about 90 to 120 millijoules at about 3,500 pulses for about 5 minutes to 10 minutes, and the results are very good as a standalone procedure. We are pretty big in cellulite treatments because of our interest in cellulite. And the cellulites, as you know, there are many, many etiologies for it. We don't know all of them, but certainly there can be an expansion of the subcutaneous fat. There can be fibrotic shortening of the septa and laxity to the dermis. So this is an example of a patient that was standalone treatment for cellulite, and the results are very good. Usually these treatments take about 4 to 6 times spread apart, and the results can be very gratifying for the patient as well as to the practice. We use a lot of this in our office for massage therapy because we have a fairly large office, and our people are very adept at how they do the massages as a part of their aesthetic treatments in our skincare center as well as in our nursing center. We use it quite a bit for plantar fasciitis. It is a very effective treatment. If they have nodules, then of course that's a different story, but for the general plantar fasciitis, 1 or 2, 3 treatments, and you can really improve the patient's well-being. The Z-Wave in our office is more of a combined treatment. We've done a total of about 107 patients. The average treatments are about 6.4 treatments per patient in all of the ethnic groups. These are the areas that we use the Z-Wave the most. And it's to the abdomen after certain procedures are done, to the hips, brassiere rolls, saddlebags, lumbar rolls, buttocks, banana rolls, thighs, knees, and somewhat to the arms and the breast. These are the types of procedures we do where we bring in the Z-Wave at certain intervals after the procedures are done, after fat transfers to different parts of the body, including the face, after suctioning of different types, after many abdominoplasties, brachioplasties, scar revisions, microneedling, thermi RF, cellulase, which is a cellulite, Coolsculpting, sculpture, vanquish. And it's very satisfying to our patients because we have another modality that we can offer to them that can really solve their problems and their side effects after a surgical procedure. This is such a patient having an abdominoplasty, and with the abdominoplasty, usually about 3 to 6 weeks after the procedure is done, we can bring in the Z-Wave and really contour the patient, getting rid of a lot of the edema and the nodules. It's quite satisfactory to the patient because it's quite comfortable by the time you get out to about the third to the 6th week. In liposuction, because I'm a consultant for most of these companies, this is part and parcel of our liposuction techniques, and you can really smooth out the irregularities after using energized types of liposuction or the traditional types of liposuction. Cellulase is a great part of our practice because I'm a consultant for the company. We began cellulase types of treatments back in 2008 when it first came out, and this particular type of treatment can be very gratifying for the practice as well as definitely for the patient. So in the cellulase types of treatments, as you know, it's usually in 3 steps. We take care of the fat first, then we take care of the septa second, and then we take care of the skin. It's all done in one technique. And after the procedure is done, then the Z-Wave is brought in generally at about 3 to 6 weeks later for about 3 to 6 treatments. I'm a consultant for thermi as well, and in thermi it is very, very useful because with the thermi device we can really smooth out the areas and increase the amount of skin changes in addition to the deeper changes caused by the thermi to the fat as well as to the dermis itself. In Kybella, is sometimes very challenging because the patients have to go through a period of swelling and redness and erythema. But generally with Kybella, starting at about probably 6 weeks after the last treatment is done, and we can do it at intervals between the treatments, we get a much better results in the patients, and patients are much more satisfied with a combination of treatments. Coolsculpting is a great part of our practice, the first Coolsculpting device in the United States, so I'm a consultant for them since 2008. It is just part and parcel of our Coolsculpting techniques, where we bring in the Coolsculpting probably at about 6 weeks after the Coolsculpting is done, but we do it immediately after the Coolsculpting, and then start the Coolsculpting treatments between 3 and 6 weeks after treatments. We've had RV studies with the Coolsculpting device. This is all published data. One of the methods that we've used is to study whether daily massaging after Coolsculpting is a benefit for that period of time, or a Z-wave that is brought in, and which of these are the most benefit to the patient. This is the data that shows the effects of daily massaging aggressively for 15 minutes twice a day for about 4 weeks, 3-month follow-ups. And you can see an improvement by caliper measurements, by ultrasound, but it's not that significant. If we bring in the Z-wave, we can really set apart our patients from really a great change in the caliper measurements by ultrasound, and even bringing in changes in their elasticity. In our practice, we use sculpture as well. This is another method, as you know, it's a non-invasive method to improve upon sculpturing of fat. I think when you use combined techniques, whether it's sculpture, or radiofrequency, or in this case, a laser, you can get much better results with a combination technique. As a consultant for MirrorDry, we use it a great deal to reduce the nodularity that occurs after the MirrorDry. And this particular type of treatment can be done immediately after the MirrorDry, or it can be done 3 to 6 weeks after the procedures are done. And these procedures are going to be repeated at intervals. Now, the recommended settings that are usually stated that most people will use are levels 1, 2, and 3, starting about 14 to 16 hertz pulse energy, usually about 120 millijoules, and delivering about 3,000, 2,500, 3,000 pulses for 3 to 6 minute intervals for the number of sessions. What we do in our practice is to augment that a little bit differently. We still work and begin at the 16 hertz. We work the 120 millijoules, and sometimes we'll go up to a higher level, especially if we're going to be improving the contraction of the skin by different methods. The pulses will stay usually between 2,500 to 3,000. The duration of the treatments are usually about 3 to 10 minutes, and the number of sessions you can see there. We have pretty good results with almost all of these types of surgical techniques or non-surgical techniques if we bring in this particular non-invasive method. Technical considerations. The treatment site should be probably no larger than 1/2 of a sheet of paper. Mineral oil is used as a lubricant. You should try to avoid splattery events because it can get into the air vents. We use the preset levels between 1, 2, and 3 to treat most body parts. And you have to move the handpiece more in a perpendicular direction across the skin, and you can stack the pulses if you wish. And you want to try to avoid overheating and switching off the handpieces whenever you go to a new site. The maximum depth of penetration can vary between 3.5 millimeters and even lower. The silicone cap should be washed after every treatment from patients, and most of our patients receive about 10 treatments at the intervals between 3 to 4 weeks. Once the tips start to wear off, then of course they need to be changed, especially the O-ring. So this is just one of our treatments that we will show you. This is a 48-year-old patient with retained fat. She had a congenital nevus removed from her right buttocks. This is the treatment area, about half a page. And this is on the other side. She opted to have suctioning performed and then immediate Z-wave performed. So they can be done concomitantly. They can be done in a delayed fashion. But the results are quite good if you bring in this particular modality to augment your surgical treatments, whether they be minimally invasive or invasive treatments. So this is step one. We're separating the fat with a power device. Just so you know, I'm a consultant for the company, the MicroAir. And after that, then we aspirate the fat. And then we go through what is called the method of smoothing out the fat, which is called fat equilibration, no suctioning, just to smooth out the fat. Manual massaging is done just so that we get most of the fluid out that we've put in by the tumescence with a drain. And then after that is done, then we go to the Z-Wave. And this is done for about 5 minutes. And we can really smooth out the area immediately after the treatment is done. So the patients, of course, anesthetized, so there's no pain involved with this, but in the postoperative period, it is quite comfortable. You can do it in a smooth way across the skin, or you can do it in a stamping method. Either one is acceptable, but the patient's results are quite good. Contraindicated areas, if you have infections, you have vascular disorders, the usual ones, benign malignant tumors. If you go over bony surfaces, it can be tender and painful. Definitely you don't want to use it over electronic devices or metals. Relative contraindication, of course, of pregnancy, anticoagulant therapies, any neurological problems, body cavities filled with air, such as the lungs, and the epiphyseal joints and groin joints in patients and children. Side effects are minimal erythema, minimal swelling. This is a worn head that you can see on your left-hand side, and they need to be replaced. Doesn't happen very frequently, generally after the amount of treatments that are dedicated to that particular head. The cost itself is about $30,000. The handpiece is about $2,000. The tip cost is about $300. The silicone cap is about $8. The warranty is about $2,500 to $3,000. And you replace the tips about after 250,000 pulses. The applications are all in the 3 areas of our practice. Generally, each treatment site is about $50 for each zone of treatment, which is half a page. Most of the sessions that we do are between $125 and $300, and for 10, it's multiplying by a factor of 10. So I think this is a very effective treatment in our practice as a standalone, but definitely as a combined treatment for minimally invasive or surgical patients. It's quite a good ROI investment. The Z-Wave has been adopted in all areas of my practice for about 4 years, and it's great acceptance by patients and the staff. Thank you.
Thank you very much, Dr. Sasaki. I'm going to now open it up to questions. And let's take our first one. What are your settings post-Kybella?
Steve, you want to take that one, or?
Go ahead. Go ahead.
Yeah, Kybella settings, you have to be a little bit circumspect upon this because there's an inflammatory component to it. So we generally will go at a lower setting, and if you wish to have those settings, just either contact Steve or myself. We'll be happy to provide that to you.
Do you feel that Z-Wave sets your practice apart from others in the community?
Absolutely, 100%. I think that it's changed my Coolsculpting practice significantly, and we advertise it, and we do videos and all kinds of social media regarding the Z-Wave. And I bought it for the Coolsculpting, but as Gordon stated, it could be used for multiple different procedures.
I think it's just been part of our practice, and it really does augment the practice because we have active areas in 3 areas that include skincare and the nurses and the surgical side. So in each of these areas, this particular technique lends itself. The revenues can be good. We try to price it so that it's not out of the realm of reality, and make it quite available for patients, because in many of these types of techniques, the secondary referrals will be much if you have such a device such as this, which is easily accepted by the patients and very importantly by the staff.
Thank you very much. How do your results compare since adding Z-Wave to liposuction?
Steve, you want me to take that one?
Go ahead, Gordon. No, you take it. You take it, yeah.
Liposuction techniques, we do a number of them because I'm a consultant for about 3 or 4 of the companies. And we do energized types of liposuctions, and we do a PAL type of liposuction as well. And as you know, with all different types of liposuction techniques, many of them have secondary events that occur that are really not that well controlled. So even though I do teach in our office the methods of suctioning and then smoothing it out and then utilizing the power assisted, there's still going to be problems with contour irregularities after any liposuction device, especially if you're using a heat-based device. So for me, this is just part and parcel of liposuction. Whether you're doing it mechanically or you're doing it by energized methods, it really does work and it satisfies the patients. And I don't think I can do liposuction as well as I am doing it, if I'm doing it well, without the benefit of such a device in our office, because you really don't score 100% with liposuction at all times.
Thank you very much. What charges are typical for cellulite patients?
In my practice, I'll charge $140 per session. And then I usually do a little more than the recommended. I usually go 8 to 10. And if they purchase it all at once, I will give them a discount of 15 to 20%.
That's exactly close to what I do. So this is the kind of device that you really can't overcharge, but it definitely has a place within most practices.
What do you tell cellulite patients to expect for an outcome improvement, and what time frame?
I'll take it, Gordon. I tell them that they're going to have a temporary improvement of their cellulite for 6, maybe 9 months, and that if they keep up with it on a monthly or every other month, that they can extend those results.
Yeah, I agree. I think in our publications and all this kind of stuff that we present, the easiest cellulite patients to treat by cellulite surgical methods are going to be the grade 1 and 2. Once you get into the fibrotic types of cellulite, which are grade 3, then it becomes much more challenging. So I think with cellulite, it is an ongoing problem of concern to the patients. Most of our patients will do well with the Z-Wave for about 9 months to a year. But then they really have to be on the wagon because cellulite is never solved by surgery. It's somewhat, some people think, a genetic problem, and it will always be a problem, but you can minimize it by non-invasive methods as well as by invasive methods and helping along with the Z-Wave.
Great. How would you compare Z-Wave to other non-surgical treatments for cellulite?
So I'm using Sculptra in combination with the Z-Wave, and I think that that's gotten my best results. Given that I'm a non-surgical extremity person right now, Gordon has a totally different view.
Well, no, Steve, I agree with you. I think I looked at Cellfina. I think it's a very good device. We work with a Thermi device, which is very similar in terms of radiofrequency. In all of these types of treatments, it is not that simple. It really requires a number of different devices sometimes to get a result that the patients would be comfortable with. So it's sometimes not that easy to just do it with one device, but if you had to choose a device that's non-surgical, it probably would select the Z-Wave. It may be a little bit slower, but you don't harm the patients, and the results can be quite good. But once you get into the grade 3s, grade 4s, I think at that point you really probably need to bring in some type of minimally invasive types of treatments.
That's right. I think that your cottage cheese is very difficult to treat, but your dimples are, I think that it's just like the face. You need fillers to treat volume loss. And so that's where I use the Sculptra. And like Gordon said, there's absolutely no risk associated with the Z-Wave, where there are some associated with some of the RF devices that are minimally invasive.
Great. Well, I think that is all of our questions for this evening. I'd like to thank our speakers and you for attending tonight's webinar. To find out more information, please go to www.zimmerusa.com. Have a great evening, everyone.
Thanks, Steve.
Thank you, Gordon. You did a great job.
Good to talk to you, and great results.
Thank you.